Hey, everybody, welcome back to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, board certified OBGYN, integrative medicine, and author of the Hormone Balance Bible. You should go check it out on Amazon right now if you want to learn all about hormones. What I wanted to do today was stay current. I want to stay current. I want to talk about current events. Talked about this today on Instagram. Today being Tuesday, April 15th, 2024. And the study came out in the Journal of the North American Menopause Society. If you go back a few episodes, I talked about the North American Menopause Society a few weeks ago. In their journal, simply coined Menopause, which is a peer-reviewed journal. It's obviously a good journal. It's scientifically vetted and very powerful in the studies. But to go back a few steps, if you remember, some of the complaints that I have had against my colleagues, especially with the North American Menopause Society, is that for years and years and years, probably more than 15, 20 years, they have been bashing bioidentical hormone therapy because it was considered by Wolf Utian, who was the first president of the North American Menopause Society, was considered voodoo, that any doctors prescribing it were, quote, quacks. I mean, pretty rude in the statements that he used. And at the time, there were really no bioidentical hormones available. There was estrase, which was a bioidentical estrogen, and there was estrase cream, which is a vaginal cream. Now, I think Dr. Utian, his whole complaint was not so much the bioidenticals, although he was directly attacking them, but was more the compounding of bioidenticals. And that's because, as we know from listening to my episode, and if you haven't listened to it about the funding of the North American Menopause Society, you will remember that much of their funding comes from Big Pharmacy, who magically makes hormone replacement. And while a lot of these companies are starting to come around to the idea of bioidenticals, some of them haven't. But this study finally came out, actually was just published in the Journal of the North American Menopause Society, called The Use of Menopausal Hormone Therapy Beyond the Age of 65 Years and Its Effects on Women's Health Outcomes by Types, Routes, and Doses. And it sounds amazing. It came out April 9th, 3 days ago. 5 days ago. Sorry. 6 days ago. I can't do math. Even though I majored in math in college. So, use of menopausal hormone therapy beyond the age of 65 and its effects on women's health outcomes and types and routes and doses. Sounds good to me. I'm excited to read this. Basically, the objective of the study aims to assess the use of hormone replacement therapy beyond the age of 65 and its health implications by types of estrogen, progestogen, routes of administration, and dose strengths. It already sounds like it's geared towards progestogens instead of progesterone, which is bioidentical. But let's keep an open mind as we go through this. And the method was they used prescription drugs and encounter records of over 10 million senior Medicare women from 2007 to 2020. And they did what's called a Cox regression analysis adjusted for time characteristics and blah, blah, blah. All right, 10 million women. As we talk about studies, that sounds pretty damn good. I'll be perfectly honest, I don't know what a Cox regression is. I don't think probably most doctors do. What they found with the results, and I'm going to kind of break this down a little bit, not to, nauseate the hell out of you, but I'll go through it kind of for those of you that like to have a little bit more data to be armed with as you go to your doctors. But these are just the general results. What they found was, compared to women that never used or those that discontinued menopausal hormone therapy after the age of 65. So they took women that were 65 and older, women that used menopausal therapy were after the age of 65 were compared to women who had never used it or discontinued the use at 65. What they found was those that were using estrogen monotherapy, meaning all by itself, just estrogen, beyond the age of 65, was associated with significant risk reductions in mortality or adjusted hazards ratio. So the mortality rate was reduced by 19%. Who wouldn't want to live 20% longer? Breast cancer was decreased by 16%, lung cancer by 13%, colorectal cancer by 12%, congestive heart failure 5%, venous thromboembolism by 3%, and we thought that actually increased for years. AFib, which is a heart rate issue, by 4%, heart attacks by 11%, and dementia went down by 2%. And how many women out there right now are scared of dementia? A lot. That was just women that used estrogen. All those reductions. Now, women that used combination therapy, both estrogen and progestin or estrogen and progesterone, they looked at both, were associated with increased overall risk of breast cancer by 10%, but such risk can be mitigated using how low of a dose of transdermal or vaginal estrogen and progesterone they use. Moreover, estrogen and progesterone exhibited significant risk reductions in endometrial cancer, which we already knew, ovarian cancer by 21%, ischemic heart disease by 5%, congestive heart failure by 5%, blood clots by 5%, whereas estradiol and progesterone exhibited risk reduction only in the risks of heart disease. So they're actually saying that the progestins were better in combination. But let's remember this. The Women's Health Initiative that came out that was studied on women that were average age of 63 in the study showed that estradiol and progestins were actually bad. However, that was conjugated equine estrogen or Premarin. This is using natural bioidentical estradiol. So their conclusions were among senior Medicare women, the implications of menopausal hormone therapy beyond the age of 65 varies by the type, routes, and strengths. In general, risk reduction appears to be greater with lower rather than medium or high doses, vaginal or transdermal rather than oral, which is also something we already knew, and that E2 should be used, meaning bioidentical estrogen, rather than conjugated estrogens. They just put the nail in the coffin of Premarin. Premarin should be removed from the market, and in my opinion, so should medroxyprogesterone, but Premarin should be removed from the market, as should Prempro. Let me say that again. Anybody out there listening that is on Premarin, conjugated equine estrogen, or Prempro, get off of it. Call me, 512-956-0296. Let's get you off that shit, and let's get you on something good. Now, I'm not going to say the name, but there was an influencer today that's saying she preferred to have her estrogen levels super high because she feels better. This study negates that. This study says, now keep in mind, it's over the age of 65, but that higher doses of estrogen led to more complications, and actually the lower the dose had the better risk reductions in some of these issues that they were talking about. So I'm just going to break this down so that it makes it a little bit easier to understand. But basically what they say is in 2002, the Women's Health Initiative trial reported that menopausal estrogen and progesterone therapy in menopausal women average age of 63 increased the risks of and occurrence of invasive breast cancer, stroke, coronary heart disease, although it reduced the risks and fractures. Now, we know that when the Women's Health Initiative came out in 2002, which was 22 years ago, it scared an entire generation of women. But worse than that, it scared an entire generation of doctors. And unless the doctors read this study, they're going to continue to be scared. So I want you to print this out and take it with you to your doctors, because they're still not going to believe it, even though it's right here in writing. So basically what they're saying is in 2002, the press presented the negative outcomes in a dramatic manner that some described as misleading. This is passing the buck. You're fucking passing the buck. If you think that this was the press's fault, then why didn't you come out 20 freaking years ago and say something about it? Doctors failed women in this instance because they believed the Women's Health Initiative. Now they're trying to backtrack. Menopause is trying to backtrack the fact that an entire generation of women has been screwed by the medical system And an entire generation of doctors has been screwed by believing some shit study that was published and that was deified by the medical community. So shame on you for now coming out and saying it was the press. You know what? Suck it up. You published it. You presented it. You said it was awesome. Just go with the flow. Say you made a mistake and move on. All right. I just had to say that. However, most of these negative results lost significance when correlated for multiple tests. Yes, we know that. The second Women's Health Initiative study in 2004 examined the effect of estrogen therapy on the same outcomes in similar aged but hysterectomized women and reported significant reductions in breast cancer. Then why the hell didn't we hear about that? Why didn't we hear about that? Because if it was only 2 years later, I can tell you, I know doctors right now that will refuse, flat out refuse, gynecologists included, but especially primary care. They will flat out refuse to give a woman estradiol. They will prescribe progesterone. They'll prescribe testosterone. They'll even prescribe testosterone and give her another medication to prevent her from aromatizing over to estrogen because they're so deathly afraid of estrogen. I hope to God this study changes all of this. However, these positive results got little press. Well, blame yourselves because you didn't promote it, and did little to reduce the fears about hormone therapy that had already been implanted in the public's mind. No, it wasn't implanted in the public's mind, passing the buck. It was implanted in the doctors' minds because organizations like NAMS didn't do their damn job and they didn't try to dissuade it. And I'm going to tell you why. Because Wyeth Ayers, the manufacturer of Premarin, was a big donor to NAMS back in the day. NAMS was supported. Wolf Utian was one of their paid instructors. He was on their payroll. Okay. He was on their payroll. They're blaming the press, but NAMS did not do anything, in my opinion, to negate this. NAMS, again, North American Menopause Society, money over matter, patients, money over patients. I'm sorry, but that's just the way it was at the time. The USDA has required all estrogen-containing products to include a black box warning for serious adverse effects with its use, even though the Women's Health Initiative only studied one type, which was, as we've said millions of times, Premarin and medroxyprogesterone, Prempro. Furthermore, but again, did the North American, so again, they're blaming it on the USDA. Well, where the hell do you think the USDA got that information? Where the hell do you think the USDA came up with the idea to black box it? It's from the damn study that you're saying the press went with that you didn't say anything about. Why didn't you go out and say something about it? Chicken. Money. Until recently, it was thought that women do not need hormone therapy much after menopause because no serious menopausal symptoms persist in women aged 65 years or older. I don't know who the hell they're talking about because I see women all the time that are 65 that are just sucking it up. And the reason that they don't say anything, NAMS, is because they're afraid of getting gaslighted because they're told over and over and over again how horrible menopause is. They don't need their labs tested because it's stupid, and they don't need to have hormone replacement therapy after 65 because they're just old. It's just part of getting older. However, studies reported that menopausal vasomotor symptoms persisted for 7 to 12 years in many women, and some hot flashes persisted in 42% of women aged 60 to 65. Again, the only thing we're focusing on are the damned hot flashes. So stupid. According to the 2022 hormone therapy position statement of the North American Menopause Society, which I dissected a while back, there is no general rule for stopping hormone therapy in women aged 65 years. For healthy women, persistent vasomotor symptoms. Again, come on, man. Can we talk about something other than the damn hot flashes? Women are not suffering with just hot flashes. Women are suffering with decreased libido, with weight gain, with insomnia, with low functioning thyroid, brain fog, so many other things. It's not just the goddamn vasomotor symptoms. Why do we have to be so damn dense that all we talk about are the vasomotor symptoms? I mean, it is so asinine and so nearsighted to me to just talk about the vasomotor symptoms or the vaginal dryness. Women are not just hot flashes and vaginal dryness, but that's what we basically break them down into. The study population was great. It was a ton of women. I think they did a good job in looking at the outcomes. They did, the statistical analysis they did. They looked at, like I said, 10 million women. Only about, what's interesting is if you look at the 10 million women that were in the study, 1.5 million of them were on hormone therapy and 9.4 million were on nothing. That just shows you how many, the dichotomy when about 85% of women were not on hormone therapy after the age of 65. Some of them may not need it. Maybe they weren't suffering, but I would venture to say probably at least 30 to 50% of those women were wishing they were on something. I think that's sad that those numbers exist. That just shows you the fear that was created by the Women's Health Initiative and the fear that was created because we didn't say anything about it at the time and we left them to suffer. We left a whole generation of women to be fearful of hormone replacement therapy, and not to mention the doctors. So let's get on to the discussion of this study. What they say is that for decades, menopausal hormone therapy after age 65 was considered to be unnecessary. Take a deep breath, Shawn, take a deep breath. Because I guess we think women die when they're 65. We think women are less productive when they're 65. We don't care about women after they're 65. I mean, what a stupid statement. After age 65 was considered to be unnecessary because symptoms due to estrogen withdrawal rarely persisted beyond the age of 65. They have no study to reference that. However, a growing body of evidence suggests that some, again, vasomotor symptoms do persist. So they're basing this all on, again, hot flashes, because that's all you are is a hot flash. And thus hormone therapy can benefit women because all you are is hot flashes. The Menopause Society changed their position about the use of hormone therapy in women age 65 and older, suggesting that the decision to start or continue beyond the age of 65 should be individualized. Well, no shit. Hormone replacement should be individualized. We shouldn't treat every woman the same because you're not all the damn same. That's genius. What a genius statement. We found important variations across different types, routes, and strengths. Well, no kidding. Again, for transdermal versus oral versus strengths, I mean, of course it's going to matter. All right, so let's get into this. With all causes of mortality, so looking at all deaths across all 10 million women, oral conjugated equine estrogen, oral Premarin, 0.625 milligrams, which is the standard dose, which was available, which is what the WHI studied, exhibited a close to significant 6% mortality reduction in the 18-year cumulative window. So meaning that women that were on that shitty medicine called Premarin still had a 6% mortality reduction 18 years following the WHI. They also found that in this study. There was a 19% reduction when we observed estrogen therapy overall is consistent with the results from a meta-analysis of 31 other studies. So what they're saying is that they basically found almost a 19% reduction when using estradiol. So it depends on the preparation. This study found that significant mortality reduction was associated with different types of estrogen and progesterone preparations. That a low dose, for some reason, they're still looking at Premarin, a low dose of Premarin with progestin, a low dose of Premarin with progesterone, a low dose of estradiol and a fake progesterone, or a medium dose of transdermal estrogen and progestin, confirming that they're saying it confirms their statement that advice on mitigation of risk through low dose, non-oral routes and different types. So what they're basically saying is, they're not being particularly specific here, but they're saying it's preferable to give estrogen topically. They would prefer to use a topical dose of estrogen. I would agree, not always possible, because some women just simply don't absorb very well. But if you need it orally, it's okay to take it orally. The big question about cancer: overall estrogen therapy or medium dose oral conjugated equine estrogen or Premarin in our study was associated with a 16 and a 26% reduction of breast cancer risk. Overall, the risks were decreased. So why are we saying that? Why are women walking around thinking that there's an increased risk of breast cancer with this therapy? I'm going to tell you why. Because people don't read freaking studies. The Women's Health Initiative reported a significant size 21% decreased risk of breast cancer with Premarin alone. Okay. Estrogen doesn't cause breast cancer. Estrogen protects against breast cancer. Even the shitty Premarin protects against breast cancer. But there was an increase in breast cancer with the conjugated equine therapy and medroxyprogesterone. So there was an increase when you combine the shitty estrogen with the shitty progesterone. But if you just took the shitty estrogen, actually there was a decrease in breast cancer. So it was the combination of the two. And that was the progestin, not the progesterone. So that being said, remember that. On average, estrogen therapy was also associated with a significant risk reduction for lung and colorectal cancers. I mean, hallelujah, this should be shouted from the rooftops. Not only was there a significant reduction in breast cancer, there was a significant reduction in lung and colon cancer. I mean, why wouldn't every woman in the world want to be on this? I mean, it makes sense. I mean, come on. Reduce your risks of colon cancer and lung cancer and breast cancer. All right. Sign me up. I don't even have a breast. Well, I do, but I'm not going to take estrogen. The associations with cardiovascular disease and dementia, similar to the results of just plain old shitty Premarin. A medium dose of Premarin exhibited no risk reductions in either 6 cardiovascular conditions or dementia. So Premarin didn't really show much of a decreased reduction of Alzheimer's. But the key takeaway there, too, is that it didn't increase the risk of Alzheimer's, which is what's been going around lately on the internet. But their results of this study showed significant risk reductions for heart disease and stroke with medium doses of estrogen. However, low doses of estrogen were also associated with significant risk reductions for all cardiovascular conditions and dementia. Transdermal or vaginal approaches, which avoid the blood clot risk and the inflammatory effects to the liver passage, also exhibited reduced risks of dementia and stroke. Again, reduces cancer, reduces the risks of stroke, reduces the risks of dementia. I mean, again, sign me up. What in the hell are we waiting for? My God, I hope somebody reads this freaking study. So basically, then they look at the strengths and the limitations of the study. They started at age 65 and basically looked at women. They tried to study the groups, comparing like hysterectomies and other health conditions. They didn't really have a way to correct for any of those errors because it was kind of a retrospective look. One strength of the study was the use of filled prescription records, meaning they could trace what the patients were using, and they had decent follow-up. It's a massive sample size, which is great. I mean, one of the biggest studies I've ever seen. So what did they conclude? Because that's really what matters here. Our study suggests the possibility of important health benefits with the use of menopausal hormone therapy beyond the age of 65. Why they had to put possibility of important health benefits, I don't know. It's like cover your ass because maybe something will come around 20 years from now and prove it's wrong, like with the Women's Health Initiative. But 10 million people, come on, that's amazing. So I would say our study suggests the importance health benefits with use of menopausal hormone therapy beyond the age of 65. Women 65 and older, you can use hormones. They're actually beneficial to you. The use of estrogen therapy, mostly prescribed to women without an intact uterus, meaning Women that have had a hysterectomy usually only get estrogen because doctors are dumb and they don't think about the benefits of progesterone. Just those women that are using estrogen alone, that can protect against risks of all causes of death, meaning you live longer. Developing cancers, meaning cancers, breast, colon, lung cancers go down. Cardiovascular disease goes down. Dementia goes down. The implications of estrogen progesterone therapy for women who still have a uterus are less clear. They weren't able to find the same results. However, there wasn't an increased risk of any of the things. They just couldn't necessarily say the same for just estrogen. However, low-dose transdermal and vaginal estrogen progesterone preparations can mitigate the risk of breast cancer, meaning those women that are on transdermal estrogen and a progesterone can decrease their risk of breast cancer. In general, risk reductions appear to be greater with lower rather than medium or higher doses, meaning this is what I do, the lowest dose possible to mitigate the symptoms. Remember, these people that are out there saying that you need to replace physiologic levels, you're not 20 years old. You're 65 years old. You're 55 years old. You don't want estrogen levels that you had when you were 25 because you can get more issues happening. That whole argument of physiologic replacement of hormones is stupid. It's a stupid, stupid thing, and I'll tell you why. Because you're not that age. It's simple. And if you wanted to restore normal physiology, then do absolutely nothing, because menopause is your natural physiology. So the fact that you're replacing your hormones to resume physiology is stupid. You're already negating your own argument. So if somebody tries to come at you with that argument, just tell them you're not 25 years old. So basically what we're seeing in this study is that estrogen is good. Combination estrogen, especially transdermal with progesterone, is good. It can mitigate all causes of death. It can prolong life. It can decrease breast cancer risks, and it can decrease dementia. So let me ask you a question. Are we going to hear about this in a few days? I hope to God we will, because this is freaking huge. This is amazing. This is probably the biggest thing to happen in women's health, like ever. I mean, like ever. The Women's Health Initiative sent us back to the dark ages, and this is finally a light at the end of the tunnel, bringing us full circle. You now have an argument. You now have data to show you that if you do this at 65, I'm going to extrapolate here and say that if it's good for you at 65, why wouldn't it be good for you at 50 or 55? That's just the age group they studied here. But it would make sense to me that if it's good for you in later life, then why wouldn't you want to be on it in sooner? So what I would do is go to your search engine, type in menopause journal, and you can type in the title, Use of Menopause Hormone Therapy Beyond Age 65 Years and Its Effects on Women's Health Outcomes by Types. I'll leave a link in the notes. You can also look up the journal article in Menopause, April 9th, 2024. The DOI number you can search is 10.1097. I'm sure you can find it on PubMed, but they only have the abstract there. If you want the whole article, you can go to Menopause. Actually, it has the article on there. I can see it. I don't pay for Menopause, so I think you can just find it yourselves. It's a great article. It's a ton of power. In the last month, it's been viewed 5,213 times. It's been emailed only 29 times. So people are looking at it. Like I said, it's only been out 5 days. It's already had 5,200 views. So it's definitely being looked at. I hope it's being spread around. I would love for you all to share this episode with your friends. Any woman that tells you breast cancer is caused by estrogen, I want you to shove their face in this article. And if they don't want to read it, have them listen to this podcast. So remember, take home message: estrogen only therapy, transdermal estrogen with progesterone, good, prolongs life, decreased risks of breast, colon, and lung cancer, and decreases the risks of dementia. I'm Dr. Shawn Tassone, America's Holistic Gynecologist. I hope you've learned something today. I have. It's been a great day. Have a great week. Catch me on the flip side. You can find me on Instagram, Shawn Tassone MD, sharing stuff with you there. And if you want to look for this article, look at the show notes. Have a great day.